Hey guys, this is not a pop quiz, but I want to talk to you about digoxin. This is a very important medication. It's an important medication to the heart, especially for heart failure. Now, the wonderful thing about digoxin is that it increases the contractility of the heart. And what I mean by that, normally you'll see the heart beating like this, right? So it's beating like this, and actually that's not normal. The heart failure patient's heart will be beating like this. So it's not pushing out enough of that oxygenated blood from your brain down to your toes. It's not perfusing the body enough because it's just doing this, right? It's not really pushing much blood out. But when you give them digoxin, remember I said digoxin increases the contractility? It does this. So now that heart is really pumping out all of that oxygenated blood to the tissues where it needs it. So it's a wonderful med that increases the contractility, but something important you need to know about this med, the second thing, is that decreases the heart rate. Why is this important for us? We cannot give that medication without checking that apical pulse first. Apical pulse is supposed to be 60 to 100. You take that apical pulse. Remember, I told you slows down the heart rate. If that heart rate is less than 60, are you going to give that medication? You better not. You withhold that medication and you call the healthcare provider and you tell them what their heart rate is. And if they tell you to give that medication anyway, you tell them to come down and give it themselves because you are not about to lose your license. You hear me? All right. So increases contractility. It decreases heart rate. The third thing, important thing about it is... what's the third thing, important thing? Dig levels. So you want the dig level to be between 0.5 to 2. Once it hits 2.5 or higher, that patient is in dig toxicity. So you definitely need to be looking at the heart rate. You want to make sure it's higher than 60, not less than 60. It increases contractility, and you need to be looking at the dig levels. Very important.